All right. Well, I see we have a full board and it's past 7:30, so I'd like to call the meeting to order. Uh, as always, we'll begin the meeting with a very brief script to just say that the meeting is being conducted remotely in accordance with Governor Baker's executive order of March 12th, 2020. Due to the current state of emergency in the Commonwealth and the local state of emergency is declared by us and the Acton Board of Selectmen due to the outbreak of the COVID-19 virus. Um, the it's necessary that the meeting be held virtually because public meetings have been suspended in order to reduce public gatherings. And we will, however, be trying to allow public access to the meeting through, something just disappeared on the screen, through use of communication technology, either telephonic or Zoom, as we're using tonight. And we do intend to allow public access for most items, typically after the board has had a chance to discuss and comment on any open action items. At which point I will call and see if anyone wishes to make any comments. And with that, I believe we can open with the first agenda item, which has been our practice since the beginning of the pandemic, which is an update from our health director, Ms. Ball, to fill us in on those things that have happened and changed and so forth since the last opportunity to meet.
Hi, good evening, everybody. So yeah, it's been kind of crazy since the last meeting. The biggest thing is the face covering order that occurred at the last meeting. I wanted to talk to the board about compliance with that. We touched on that briefly at the last meeting. I'm starting to get quite a few complaints, especially for the users of the rail trail and our conservation areas. So we're getting some more permanent type. They look like, the signs that people put, with the metal prongs in your yard. So we're getting some kind of vibrant signs made that we're going to put up rather than right now we have like bright yellow 8.5 by 11 notifications of the requirements. And unfortunately, if on conservation areas, they're at a kiosk. So if you don't walk by the kiosk, you might not see the sign. So we're in the process of getting signs ordered. I'm hoping that those signs will help. But if not, I just wanted to bring up that, we may have to have deeper discussions in the future about that because it's constant. The complaints are constant.
Cheryl, if I could just ask, one of the things that I've not quite fully understood is some people don't have to wear masks if I believe there's a variety of exceptions.
Right.
And at one point it was you were not allowed to ask if they had an exception, but I understand that has changed and now you can ask. Is that true?
Only schools and your workplace can ask. So the boards of health cannot.
Okay.
That was clear at a conversation we had with the DPH last week.
So if someone's not wearing a mask, what's the just an example? What do you say? Hi, why are you not wearing a mask? Or is that asking why they're if they have an exception?
Yeah, I mean, technically it kind of is, but I mean, they don't have to tell you why. But we're not, and it could be some of that, Bill. That could be some of the issues that there are people with medical exemptions and they're not wearing them for those reasons. But it seems a bit more widespread than that. And if everybody has a medical condition, which I hope they don't, I'd understand that. But it just definitely seems to be a bit more widespread.
No, I'm sure you're absolutely correct. I'm just trying to think of, how do we, what is the approach that we're allowed to do? You see someone on the trail that doesn't have a mask and, you're, say, a police officer. What do you do? Do you say, pardon me, sir, you appear not to have a mask, or?
So when the police patrol it for us, they usually have masks in their hands and they usually pass them out and people take them and put them on. That's usually what we're seeing. I mean, there probably are some people that say, I can't wear one or, but you're right. We can't drill them on that. We can't get them to divulge. So if they say I can't wear one, then we say, okay. You know, I mean, there's nothing more we can do, but it's, you know, there's a lot of residents out there that believe that everyone should have a mask on regardless. And I think that's some of our complaints. Definitely. It's definitely a factor.
Mm.
But
Well, unfortunately, I think it puts us in a kind of a no-win position, right? Where we can't ask, but we're expected to get people to comply.
yeah, exactly. It's a catch-22. It's a frustrating one as well. So, you know, moving on. So one other thing that the state did this week is they updated the amateur sports guidance, and they've issued a new exemption for face coverings for some sports. One of those is tennis. As long as they can maintain a 14-foot distance, and it's like for singles tennis only. So in the beginning part of last week, I probably took about 15 phone calls from tennis people, not going to a center that wasn't wearing, that people weren't wearing masks. So the state went and updated that, which again makes it frustrating for us because it's difficult to enforce one thing and then have exemptions for others. So it's unfortunate they did that. You know, like I said, we're just trying to do the best we can with that. The other thing with Thanksgiving coming up, and I know we'll probably have another meeting before then, there's just some things that I want everybody to consider. You know, make sure that there is there is private home guidance that restricts you to 10 people indoors and 25 people outdoors. So there's, you know, not requirements, but the suggestions if you're going to have people outside the people that live in your home at your home for Thanksgiving. And they're asking you to maintain the 6-foot distancing, wear a mask, keep some ventilation by opening your windows and washing your hands. So I just wanted to point that out because we do have a pretty major holiday coming up. The other thing I wanted to talk about is there's new guidance now for hockey, for no out-of-state teams are allowed to play at mass facilities. Out-of-state border athletes and coaches are subject to the travel order now, which is something new. So if you happen to live on the line and you go and you cross over and you play in like Fitchburg, you would be subject to the travel order unless you're coming from one of the lower risk states. And the lower risk states are dwindling. It's Vermont, New Hampshire, Maine, and Hawaii right now. But Vermont and Maine are not reciprocating that. They won't let Massachusetts residents go there. So I guess that's about it for me. I know there's, you know, I'm not sure what the others are going to talk about, but if you have any questions, I'd be happy to field them now.
Sorry, needed to unmute. Sorry, members of the board, any questions for the health director? Mr. Cruz.
Yeah, thanks, Bill. So after the governor's new orders went into effect, you know, I do a lot of walking in the neighborhood, and I get, you know, it seems like the skate park is now closed, but it seems like a lot of kids are now going to the Elm Street playground to play basketball and hang out and whatever else. But, you know, it seems like, you know, looking at the tennis courts, you know, they're packing the tennis courts and essentially, you know, it's like the governor's orders never existed. The kids, you know, I struggle a little bit. Maybe this is just a rhetorical statement, but you know, what do we do as a community, you know, to get better compliance with this? And I don't know, maybe there's some spot checks that need to get done. And I think it's particularly bad, like right before the sun goes down, but maybe some spot checks. And I think if it gets bad, we maybe want to consider again shutting down the town fields again. That's it.
Okay, thank you, Mike.
See, Bill, I do have one comment.
Yes, Dr. Taylor.
Well, mandatory masks means now when you're walking outside, even social distancing, you're supposed to wear a mask.
True.
That's much more rigid. So I'm sure a lot of people are still not wearing masks. And Mike, I certainly hope you were wearing a mask when you were out walking, observing all the rest.
Oh, I definitely was, Dr. Bill. I think we all understand the importance of the governor's orders, as well as the implications of not following the orders. So yes, when I leave the house, I always am covering the face and maintaining social distancing when possible.
Not to say I'm accusing you of anything, Mike, but basically people got into a pattern, and I'm sure it's harder for them to remember. They used to go walking without a mask, and they used to sit on their front porch without a mask. So those have all changed.
Well, I think the second they can still do.
Right. If it's on your own property, I think you're good to go.
So, and it's family members that you're within 6 feet of. Well, all right, Mr. Conaby, I think you also wish to make a comment.
I was just going to ask a question about the number of cases we're seeing in town and a little bit about the contact tracing, how that's going.
Oh, I'm going to just suggest that probably Director York will probably address that very shortly.
I didn't know if she was going to be able to join us to do that, but if that's the case, I'll certainly wait. Thank you.
Okay. All right. Well, if there's no other comments, any comments or questions from the public, Cheryl?
Sorry. No.
Very good. In that case, just as Mr. Conaby suggested, Director York, Director of the Public Health Nursing Service, would you please let us know how how the town in general is doing?
Hi, Bill. Good evening, everyone. So I will go over, and I'm going to be brief because I know you guys have a full agenda. The cases right now, as of tonight, we have 270 cases overall for the cumulative amount. Since March, we have 23 folks on isolation, 226 recovered, and then the initial 21 deaths that we are aware of from the beginning of the pandemic. It's been a busy week, as Cheryl said. We've had 24, actually 26 counting today, new cases in the last week, which is definitely concerning. I know Mark just asked about the contact tracing. So there is, we have a lot more contacts for each positive case based on school, based on sports, based on family, friends. A lot of these positive cases are coming from folks having family Sunday dinner with relatives outside of their home. Seems to be one of the trends and the highest trend that we've seen right since the pandemic started, especially into the fall. So that's concerning, where Cheryl, did mention Thanksgiving and the guidelines and the recommendations made by the CDC and the Mass Department of Public Health. If people could check out the website, the cdc.org and mdph.org, I think it is. They do have some good recommendations. I know it's a hard time of the year, and it's been such a rough year on everyone with social distancing from family and friends. But with the cases going up, I think reading those recommendations is a good idea to try to help reduce some of that spread within your own home, as you're possibly bringing relatives who aren't in your immediate family and household into the mix. So just a suggestion. I know, thank you to Cheryl and her team. They have helped with some of the contact tracing in the last week, especially related to the schools. The school nurses have been fantastic, as always, and the administration also, just getting all of those, getting all the information to us for all of the contacts for the cases, for the positive cases that are at the school. I know Peter Light was possibly going to be here tonight to discuss, so I will let him go over that with you. And And that's really it. Just basically very busy with positive cases and then following up on all the contacts.
All right. Well, thank you, Heather.
Thank
Just
you.
a few just questions. One of the things that became a concern when we had the wave initially was the availability of personal protective equipment. Is that no longer an issue that you need to worry about?
It hasn't been an issue since the very beginning, and I hope that it does not become an issue. As of right now, we are the town is in a good position getting the PPE that they need.
Okay, thank you.
Mm-hmm.
And that's the only other thing I was going to ask is I believe the next thing we are going to talk about is related to the schools, and I just wondered if you would be willing to stay on the meeting until that subject has been
Yep,
addressed.
absolutely. Yeah, that was my plan.
Great, thank you.
Sure.
Yeah,
Other members?
well, I have a question for Heather. Do the cases in Acton include all the students from Acton?
The total number of cases that I have would only be Acton students, yes.
Yes, because I will be talking about this soon, but in the document that the superintendent sent, there were 352 symptomatic students and teachers who were quarantined. I don't know how many of those were tested, but I mean, that's a huge number.
So Peter may be able to answer that question better, Dr. Bill.
Okay.
I think how they broke that number down, and he can talk to this. The school nurses are tracking anyone that is symptomatic within the school, staff and students. If they have to leave school and be tested, they're doing that and they're following up. So they're doing a lot of follow-up with the students and the staff. I believe that's the breakdown, but Peter definitely could answer that better.
Okay, I see Mr. Light has joined us.
No.
And
Before we go on to that, could we just go back to one item? We had 26 new cases in Acton. Could you give a little information about whether these are family members, groups, or whether you're seeing any of I know there was an assisted living facility case reported, or a little bit more about the demographic trends?
So basically the demographic are families, but they are also residents who are either becoming a positive case after having contact with a positive family member who is outside of town or within their own home. So there is definitely a larger number of spread within the home, but a lot of these cases originally either they've started in Acton or they're family members who live outside of Acton who have then infected another family member from a different household. As of right now, Life Care of Acton has been COVID-free since June. I did talk to Robbinsbrook, the Inn at Robbinsbrook, Benchmark, about 2 weeks ago, and they did have one employee that was tested positive. They're doing random testing. The good thing was the person had not worked for a number of days before the test and the symptoms started. So there was no exposure within the assisted living facility.
Okay, thank you. Other questions or comments from members of the board? All right, I don't see anyone. Cheryl, any questions or comments from members of the public?
No.
Very good. In that case, just to sort of open the discussion, it looks like Mr. Light has joined us. Thank you very much for doing that. We did, at least I read your letter. I believe the majority of the board did. And we're obviously, very concerned about how we get in front of this. And thank you for taking the initiative to come and talk to us about it. I believe, as Dr. Bill just mentioned, he, some of the numbers were a little hard to break out. I read the 350 symptomatic slightly differently, that it was people that were related to someone who was positive. but perhaps, sorry to open the discussion with a question, but but just to answer Dr. Bill's concern, can you explain a little bit more about the basis for that number? You must be on mute because we can't hear you. Still can't hear you.
Uh-oh.
How is that?
Much
Yeah.
better.
I don't know what happened, but that's okay. So, I'll give a very brief overview of this data because I think that may answer the question. But we've been tracking about just over 1,000 individuals so far this year. And before I start, I just want to thank Heather. I want to thank Cheryl. Joanne Chadwick is our nurse leader who's been serving point. Dawn Bentley is one of our assistant superintendents who helps coordinate nursing. So all of these people play absolutely critical roles. I'm so thankful in particular to Cheryl and Heather for all of the work that they've done to help keep us open. But we've tracked about 1,082 individuals. And so that includes a number of different areas. Of those, we're actually up a couple as of today because the memo was written midweek last week. So we're actually at 26 individuals now who have tested positive in our school community, and that includes students and staff. Of those 26 individuals, there's roughly just under 300 close contacts. So the 284 number are the actual close contacts who have had to quarantine. In addition, one of the areas that was very important to us starting off was to actually track any individuals in the school community who became symptomatic. And that could be someone who goes down to the nurse and has a cough, runny nose, could be an isolated incident where a parent calls a student in sick for a day because they're being cautious at home. We do enter them into a tracking sheet, and some of the individuals their symptoms resolve immediately. It's clearly not COVID related. They do return to school right away. Other individuals might go get tested. It comes back negative. They consult with their physician, and the physician has recommended they're able to return. So those symptomatic individuals are not the standard day 14-day quarantine. And then the asymptomatic abundance of caution group, those are individuals who have kind of self-isolated themselves because they're worried that they might get someone infected. What we see typically of that group is there is a brother or sister in the family who's determined to be a close contact, and the parent might decide that all the siblings are going to stay home from school until that person gets tested. They're typically missing school, but it's not because anyone on our end or the health department told them they need to stay home. And then we've also monitored interstate and any international travel, and we've had about 50 individuals who fall into that category. So hopefully, does that answer your initial question there?
Dr. Bill?
It does partially, but I know the issue about testing, and let me just step back a bit. In nursing homes nationally, there are regular testing of everyone, staff and patients, because the first outbreak they found out that 30% of the nursing home residents were asymptomatic and positive. So they do regular testing just to make sure that anyone that tests positive is separated from those that are negative, and usually separate wings. And one of my questions here, what's happening to the ones that are symptomatic? Do they go and get tested themselves privately, and then do they report back to you about test results?
Correct. So it's a little bit interesting on the school side. We can't require anyone to be tested.
I understand.
But we highly, highly recommend it. And most families are going and doing that. I think we've only had a couple of families who said, we're not really interested in testing. We'll do our 14 days and come back. But typically families are pretty good about going and getting tested at one of the sites and then reporting results back to our nurses. So that's typically the process that we're following.
So I would recategorize those symptomatic. If they had a negative test, they shouldn't be on there. I mean, basically, the issue is, and I know you're not in a position to screen the same as in a nursing home, and I'm certainly sympathetic to that. But I think it is important to get people out of those nebulous categories. And if they're reporting back negative, I would take them out.
Absolutely, that's great feedback. We actually do take them out. But these are simply the numbers about how many people we've tracked since the beginning of the year. And the reason that they ended up on the tracking sheet in the first place, but we actually have a master spreadsheet where we keep track of every individual case and then kind of graduate it out as it goes on through the system. Does that make sense?
Mm-hmm. But you're finding 14 contacts for every case. Looking at the 18 students and then the 248 close contacts, that's a fair number. Are those mostly other students, or?
It's a combination. So when we do close contacts, we approach elementary close contacts and secondary close contacts differently. Our desks are generally 6 feet apart in a classroom, but with an elementary school cohort, typically there's about 12 students in the room at the time, and a teacher and possibly an assistant or even a second teacher. So you might have 12 students and 2 or 3 adults at any given time. In an elementary school class, those individuals are typically in that same room for 6 hours a day. And with young kids, there's a lot of movement that goes on. It's not going to be, third graders all sitting at their desk quietly for 6 hours. So, in working with the health department, as we look at an elementary classroom, if people have spent the whole day together in a confined environment like that, we're generally quarantining a cohort, which is all of the students. So you're going to get 12 students typically, or at least the kids who were present in school that day. Plus, you're going to end up with the staff on quarantine as well. Mm-hmm. At the junior high and high school level, the classes are shorter. They're only about 45 minutes long. And there's very little movement around the room during that period of time. And then the groups change. In that situation, we do basically draw the 6-foot radius around, and we quarantine basically whoever was in that 6 foot, around that 6-foot radius in each of that student's classes, and go through that, which sometimes means the teacher doesn't have to quarantine at the secondary level.
Okay. Well, you may want to give a presentation in general. I don't want to get lost in these specifics, so sure. I'll turn it back to you.
Yeah, sure. Well, actually, that was kind of the second part of the presentation anyway, was around just what we do with the contact tracing process, because I think, it's important for people to understand that we treat the different ages differently because of the duration and the amount of movement that goes into the different levels. The other thing that we've tried to do, and it's not really a presentation, but talking you through the memo, we've tried to be very transparent with the school community about when we get cases and where they're occurring, so that people know. To the degree we don't want anything to be identifiable, so we do have a dashboard that we released, which people can see all of the cases that have occurred in each school, and we track that by week, so people can get a sense of that. And that's listed right on our website. And then we also publish public health metrics, which are the state system of coding schools and communities. I don't know if anyone had a chance to look at, kind of the comparison of the prior state metric to the current metric. This was interesting, and I'd be really interested in hearing any feedback on this. The metric was recoded to keep more schools open for longer. And what we heard out of the governor was the recoding was primarily to provide more clarity for smaller communities. So we now have to track Acton and Boxborough using different metrics. The Boxborough metrics are for communities under 10,000, which is just a hard count of the total cases. If you've looked at the weekly report, when you look at total cases, I don't think the state actually meant total cases because that's cumulative in that column. I think they actually meant the weekly case count or the 14-day case count, which is essentially what we're using. And then Acton goes for the mid-sized community, which is now a combination of, the 14-day, incidence rate per 100,000, as well as now a positivity rate. We've been tracking positivity rate anyway since the opening of school, just because that was one of our important metrics. But what's interesting is they nearly, or actually more than doubled the threshold to go from green to yellow and then yellow to red. So Acton, this past week was a green community, but I believe, and I don't have it right in front because the Zoom meeting is taking up my whole screen. I believe our positivity rate was 7.4, not positivity rate. It was the average 14-day average of cases. That would have been very high yellow previously under the old metric. It's now green. And under this new metric, you would have to see that same high number of cases as well as a greater than 5% positivity rate. So the threshold is really different. It's certainly something that, it's great because it's allowing us to stay open longer, but we're certainly balancing a lot more cases as we do that. And we did see a pretty significant increase in cases over the last week or so, where, in the first probably 6 or 7 weeks of school, we had, I think, a total of about, 12 or 13 cases. And then in the last week, we've had about 16. So that's a pretty significant uptick. We're hoping that we don't see that trend continue, and maybe it was like the Halloween anomaly. That it feels like it might be about that right period of time where Halloween catches up to us, but certainly something we're thinking about. So that's, really the metrics are one piece. And then what I wanted to do primarily too was just talk through a little bit of kind of our overall thinking in two different directions. One, what would we be thinking about where we might end up having to close schools? And then what might we be thinking about if we want to try and continue opening? I don't think in the middle of this surge, there's many of us in the school district who are thinking that this is the perfect time to be trying to go fully open. I do think that's something that we would like to try and explore as we get towards spring, if there's a way to bring more of our students back. But I think it really depends on what the other end of the surge looks like. In terms of our thinking around if we would have to close, obviously we use this kind of stoplight metric as something, but a couple of other considerations. I think from an educational perspective, there's probably a tipping point, and we haven't hit it yet, but as more and more students have to quarantine for 14 days, there's a real discontinuity of education that happens when kids are now not in school or teachers are having to quarantine. And I could see that there'd be a tipping point where we just can't provide good educational services. And we might think we could be more consistent by going fully remote. We also could end up in a situation where enough staff are out on any given day that we can't run either one of our schools or multiple schools, and we have to close because we just can't staff safely. Getting substitute teachers has been particularly hard this year because there's not a lot of people looking to work in schools right now. So staffing has been a challenge across the state, and it's not unique to our community, but that's certainly something we're thinking about as well. We are trying to prepare ourselves to be open for the long haul, to be honest. We actually just purchased, we had previously purchased air purifiers for any space in our schools that didn't have an operable window. But as we come into the winter, we just submitted a second order for air purifiers that are sized for all of our classrooms in the district, even if they do have air purifiers. So, we're a big place with a lot of different classrooms. So this second order of air purifiers alone was about $250,000 to be able to do that. But that will actually put all of our classroom ventilation at the highest standards of healthy schools that the Chan School of Public Health is recommending. So we're excited about that. We think that's going to help, make sure that the air that kids and teachers are breathing remains healthy, and we're getting enough air exchanges per hour and staying on top of that. I think, one thing we're looking at is there's growing evidence, particularly for younger kids, that the 6-foot rule may not be as significant as once thought, particularly, and still is thought for adults. I don't know if anyone has followed the work of Joe Allen. He is over at Harvard, and he's in their, healthy schools division of the Chan School. And he's really, thinking that we need a much more balanced approach to assessing risk for kids, that the risks we're seeing in kids for, and we're hearing it from a lot of physicians as well now, for obesity, for suicidal ideation, for general mental health disorders, loss of learning, are actually greater than the risks of student health contracting COVID. So there's some emerging thinking that we're starting to look at, that the adults need to keep 6 feet of distance from people, but that the kids may be able to go under that. And, in the middle of a surge, that's not so relevant to us because we're not going to start putting more students in our classrooms right now. But as maybe we can get to the other side of this surge toward the end of the school year, that might become a little bit more of a thought. I don't want to go on too long. The memo was there, but I wanted to just highlight a little bit of that thinking for you. Answer any questions you have. And, I'm particularly interested in any reactions to kind of the new metrics, any thoughts that you would like us to keep considering. We are still exploring testing options for our students. We did some initial math, and I have been in contact with some representatives for the Broad Institute. Because of our population size, if we wanted to test all of our students and staff on a weekly basis for about 10 weeks, using kind of the pooled method of a PCR test, the self-administered, nasal PCR pooled method, but we would get individual results. It's about $25 per test, but that would cost us about $1.25 million for about a 10-week span to do everyone on a weekly basis, which is why we haven't gone down that route yet. It is something we're thinking about, particularly as, is that something we want to do maybe during a surge to be able to keep our kids in school longer and make sure our teachers are safe and kids are safe and everything else. So with that, I'll pause and see what questions you have.
All right. Well, thank you, Mr. Light. Very much appreciate your joining us. And one of the things we'd like to know is, I very much heard your say you're supportive of Cheryl's engagement, and we're very much supportive of Cheryl as well. But is there anything as the board in terms of setting policy that you would need? And you don't have to answer that now, but if there is something that comes along, please, reach out to Cheryl and bring it in front of us. I just had a question when you mentioned about the distancing and so forth. There was an article recently in the journal Nature that said that most of the COVID spreading, and this is very generalized, but it was using anonymized cell phone data, and it said it appeared to occur at meals, that about 25% of the transmission appeared to occur at meals. What do you do for the students at traditional school lunch? How is that handled now?
Yeah, so I think from a social perspective, lunch used to be the center of students' social life, and it's now probably the least social time that they have. At the elementary school, the students actually eat in their classrooms with desks spaced, a minimum of 6 feet apart. They're all facing in the same direction, and they can remove their masks just to eat. We have a staff member in there that supervises, but they're more than 6 feet from any of the students. At the high school and junior high school level, we still do use the cafeterias because it's not practical to be able to keep the kids in classrooms. But like at the high school, all of the cafeterias are in use. They also converted one of the gymnasiums into a makeshift cafeteria for students. And then they also have a large tent outdoors that students can eat at. And we'll keep that open as long as possible. Same thing, even in the large gym, all of the desks are 6 feet apart, facing the same direction. Students go in, they eat their lunch, and then they're done and they leave. But that's really how we've been handling it. We feel really fortunate that of all of the cases we've had and all of the close contacts we've had, we've only had one incident where we suspect that there was transmission. And we say suspect because initially we thought pretty strongly that there was transmission, and it was a staff-to-staff case. But as we learned more over the period of time after it, we have become less certain. But we did report it as in-school transmission. So I'm knocking on my wood desk right now, but we have a pretty good track record that the safety protocols we've had have not resulted in transmission inside the school.
Thank you. Okay. Are there questions or comments from members of the board?
Yes, I have two comments. First of all, they estimate in children that 40% are asymptomatic and they're contagious. So what I'm trying to say is you have no real control over transmission, because if they're asymptomatic, they're never a case, and then all the contacts are not identified because of that. So I want you to be very cautious about thinking that nothing is going on in the school because of that. The second one is the transportation. How many students take the bus into school?
Our ridership is significantly limited this year because we are putting a maximum of about 24 students on a bus. The bus, it's actually, I believe, an 88 passenger bus.
Okay.
And we're using about a third of that capacity.
Okay. That makes me feel a lot better.
Yeah. No, the windows remain open the whole time, regardless of the duration of the trip.
That was what I was going to say. I'd keep the windows open in winter too.
Yeah.
Okay, those were my only two comments.
Sure.
But I thought your report was really excellent. I appreciate the work you're doing. And you're now, by happenstance, working in public health as much as you are education.
I have learned a lot this year, and I'm continuing to learn.
Very good. Well, thank you, Dr. Bill. Any other members? Dr. Singh.
Yeah, I was wondering, have you thought of having remote synchronous classes through Zoom in case there's surge after Thanksgiving break?
Yeah, so that's a great question. So all of our schools have been working to develop remote schedules. If we close for a period of time, like we have to quarantine a school for 2 weeks, kind of as an individual school, and we know it's just for a short duration, it's really going to be the same schedule that students have now, but it will just be fully remote. So they will be synchronous classes. If we close for longer and we foresee, maybe a period, say we really saw that, look, we're going to have to close because we're seeing spread in the schools. We're in the middle of the surge. We don't see it getting better in a couple of weeks. It's probably a longer term closure. We're actually finalizing schedules now to be able to have that. We have a fully remote learning program that actually serves over 1,000 students. Probably about 800 of them are at the elementary level alone. And we've modeled the learning time around what that remote learning program looks like. So absolutely, if we close and go remote, it will be synchronous classes. The high school has a schedule, the junior high has a schedule, the elementaries are finalizing it now. And we've also developed a remote learning guide for families to be able to think through what they want to do to prepare, themselves and their students to have to go remote.
Okay, thank you.
Thank you.
Sure.
Yeah, because like that way the students can communicate with their teachers via Zoom, because the teachers will be there, and they can also see their classmates, and like obviously it won't be the face-to-face communication, but at least they'll be able to communicate their thought process with the teacher as well as with their classmates. So
yeah, absolutely. I think at the elementary level, we know, and we've actually been consulting with a doctor over at Children's Hospital around, appropriate screen time for kids at that age. So at the elementary level, it's probably the equivalent about a half day that they would be synchronous with a teacher online and half day with kind of asynchronous learning that they're doing on their own just to get them off the screen. And then at the high school level, it's much more approximates just a normal kind of rotation of the schedule. Students would be synchronous.
thank you.
Sure.
I'd like to make one other comment for Mr. Light. I think you have an option of a public health intervention. You could periodically interrupt in classroom teaching for 2 weeks. And then when that's restored, there's no one that's going to have a case. So you could periodically interrupt any potential for transmission. And you could do it on your, when either your teachers were getting overloaded or, and I think that's, you're already set up for the remote, and then after the 2 weeks, bring them back in.
Right. Yeah, we were back in October when we had that one suspected case of, transmission within the school.
Mm-hmm.
Any one of those close contacts from that case had tested positive, and we actually brought in the state lab as a mobile response unit.
Mm-hmm.
If any one of those had tested positive, we would have closed Miriam for 2 weeks to do just that, and then reopened it after we had that period of time.
Good. But that's a strategy you can use any time along the whole continuum. If the surge gets worse, everyone stays at home and they only come back if they're well.
Right.
Yeah.
Okay, thank you, Dr. Bill. Mr. Conaby, I believe you might be wanting to make a comment. You're on mute, Mark.
Yeah, hard to get this to work. Thank you, Mr. Light. We really appreciate all of your efforts and a great update. A few questions. I mean, you talked about getting a little bit of feedback. I think Dr. Bill talked about symptomatic. I think a lot of folks, it's not fully symptomatic of COVID, it's exhibiting any particular symptom that might be COVID is what you're talking about, like a fever or cough or something else. So maybe providing a little bit of detail on that, let's say suspect or monitor, some of the terminology, just so people aren't alerted like Bill that are saying, my goodness, we have that many cases, but to commend the decision to track and to report that information. I guess following up on that, talking about the information for the town, it's very important that everyone has full transparency, and we've tried to do it as a town with our data. Maybe trying to break it down between the secondary and the elementary schools for the number of cases would be a little bit helpful, because they are a little different in the way the folks are doing their programming and things. That might be helpful going forward. It would not be saying a specific school, but it would help provide community information. So I think that'd be one comment to suggest. Getting back, it sounds like your close contact, you're using the prior recommendations of the elementary school cohorts for close contacts. Is that correct?
Say that one more time.
It sounds like you're using the description of a cohort being in close contact at the elementary school level for contact tracing.
We are. It's a pretty conservative approach, to be honest. We actually, the state has actually told us you could do close contacts at any level as anyone who was within the 6 feet distance. So technically, according to the State Department of Education, if your desks were 6 feet or more apart, no one would be close contacts of the case. But, when we talked to our health department here and over in Boxborough, we found that to be really challenging. And we felt it to be a bit risky in terms of the spread of the virus. So elementary, it's essentially the entire cohort or the group of students that attend school together for the day. And at the secondary level, it's, the radius of 6 feet around the individual.
And the timing. You mentioned there's been a significant increase in cases. Do you have any insight as to why you're seeing that in the schools right now?
And Heather could probably jump in on this too, because she sees a lot of the cases. We've had, we're seeing family as the primary source of transmission recently, in all honesty. We had, I think, 7 cases between 2 families, 2 households in the span of 2 days. That was one huge jump for us. We've seen a little bit of youth sports, outside the community. We also had a little bit of that youth ice hockey issue that happened to us that we all heard about. Heather, anything else in particular that you can think of?
No, Peter, you covered everything that we've been seeing as a Board of Health. Thank you.
Excellent. I guess maybe you could also provide a little bit of insight on the mobile testing. It sounds like that was a good proactive step. Maybe you can tell us a little about your experience and whether you'd anticipate using that again or how that could be leveraged to help prevent some of the spread.
Yeah, so there's criteria that the State Department of Education put out with, the Department of Epidemiology at the state level, where you have to meet certain criteria to access that mobile testing unit. And essentially you have to talk them through the case, and they have to determine also that they think there was school-based transmission. And if you get school-based transmission or an increase or a cluster of cases, then they actually are the ones that are authorized to activate it. We can't do that ourselves, which can be frustrating. We had a great experience with them. I know other superintendents have been very frustrated that they couldn't get the mobile response unit. And in all honesty, our contact at DESE, when we told them that the state activated it, they were pleasantly surprised as well. But, they came out, you have to wait, obviously, for the testing window of that kind of 4 to 5 days after the last contact to get into that right testing window. But they came out right in there. We worked to schedule all of the families and students and staff who were going to be tested, gave them each a time. We did it as a drive-through center out in front of our administration building. People went in and out, and I think we actually got our test results back in about within 48 hours. So it was a pretty good turnaround. So it was good. I think, one thing we've thought about is even just, signing on with a partner, that if we wanted to do mobile testing on our own, we weren't beholden to the Department of Epidemiology to say yes or no, we can do it. That would probably be a good use of our resources internally, is to have control over whether or not we do it. And if we can get a vendor that partners with Broad, they're still guaranteeing a 24 to 48 hour turnaround on the test results. Whereas what we're seeing from a lot of the labs statewide are, ranging almost to 5 days now on some of these tests, which makes our internal process uncomfortable.
Yeah, time is of the essence. One thing, following up to Dr. Bill's comment about the 2-week time period, obviously it does break the cycle within the schools, but there's still other activities. But scheduling some of that time during some of the school breaks to have a 2-week period might be something to be considered. Where you're already off part of that time, to extend it slightly, either direction around some of those breaks might be something you would also consider.
That's really interesting, because there were a number of schools, and we had started to loosely talk about it, of closing, between kind of Thanksgiving and the winter holiday, and then reopen after New Year's. The Commissioner of Education came out very strongly and said that was an unacceptable practice for schools. The state is very much trying to keep schools open in person for as long as possible, and they really don't want schools closing proactively, and they've put some really tight constraints around us for what they want to see. That's actually one of the reasons I wanted to talk to all of you, because I think what we've always said with our health departments is we value the local decision making in that. And if we don't feel it's safe locally, we want to be proactive in doing the right thing. So that's part of the reason for the discussion tonight as well.
Thank you. I'm just thinking that if you were off for 10 days and if you see a significant surge, adding a couple extra days of remote and then readjusting the schedule to still have the in-person contact time subsequent might be an option. But the point is to be proactive to it. Yes, like you folks are, which we very much appreciate. And thank you again for all your efforts.
Sure. Thank you.
Yeah, I'd like to make one other comment, and that's what they call the long-term complications of COVID infection. And it's being seen in adults, cardiac issues, neurological issues, losing taste and smell, those kind of things. And this goes on more than, I think it's defined as more than 3 months after you've recovered from the initial infection. And I haven't heard very much about that affecting children, but I think it's something, you shouldn't be trapped into saying we've got to keep those kids in school because you feel better about the positive effects of school when we don't know all the negative effects of COVID infection. And the reason I brought that strategy up is by interrupting any transmission in the, just stopping the school for 14 days, they all come back fresh. And that's your only control because 40% are asymptomatic.
Mm-hmm.
Okay, thank you. Is there other comments or questions from members of the board? And Mr. Light, I'm not sure if we answered your question about the state guidance. We certainly noticed that too. We certainly noticed that they are working very hard to try to provide a framework to keep the schools open. And it seems that that's probably a good decision, although as you mentioned, the younger population seems to have a much better response or outcomes with COVID. The problem that I always am concerned is they're bringing it home to their grandparents. And that's, if we could pass a message to the community, it would be that's, to please practice in the home, very good COVID safe practices. I'm sure you love your grandparents, but you may need to keep your distance at least until this pandemic passes or something. Mr. Cruz.
Thanks, Bill. Mr. Light, I have done a lot of walking around town, and one feedback I would give you is I see a lot of non-compliance, but the Acton Boxborough district teams seem to have a very high compliance with the guidelines, and I don't know if you could feed that back to your team, but it's a good sign.
That's great. I will definitely share that because I know our athletic director and coaches have been trying to be very, very vigilant about it. So thank you.
I have a couple of questions. Yeah. The first question is, you mentioned that you cannot require testing. Is that a school board issue or the state? And my second question is, the new metrics, you have different issues for Boxborough and different for Acton. How are those? I think you might have explained it, but I didn't quite get it. How it's going to work.
Sure. So that the guidance around us not being able to require the testing is actually state guidance, and it's just a legal contingency. We can tell students that they can't be in school for 14 days, but we can't require them to get tested because that's just outside the scope of our authority. So that's the piece of that. In terms of the different metrics, so Boxborough is, about a 5,000 or 6,000 resident community. And under the new metrics, any community under 10,000 residents goes by kind of the hard case count over a 14-day time span. So for example, if you have less than or equal to 10 cases in your community over a 14-day time span, you're coded as gray. If you're under 15, you're green. If you're under 25, you're yellow. And if you're over 25, you become red. That's just the hard case count. For Acton, it's actually using the 14-day daily average of cases. And so if over that 14-day span, you're seeing, now actually the gray, this is what gets convoluted. You're gray if you have less than 10 total cases in a 14-day span. So that's your baseline. Once you get past that though, if you're averaging less than 10 cases per 100,000 residents, but you have over the 10 total cases, now you're going to be a green community. If you are greater than or equal to 10 average cases per the 100,000 residents, that would put you into the yellow range. The other way that you can go into the yellow range as a community is by having a equal to or greater than 5% positivity rate. And then the only way to get into the red now is to have both of those two criteria. So you would have to have, that daily average of 10 cases over the 14-day span for 100,000 residents, and you would also have to be greater than 5% positive. So that's what we've been monitoring. And we've...
If Acton is green and Boxborough is yellow, then what does that mean?
No, so the direction we've been given by the state is for regional districts, because we're monitoring multiple communities, we should go with the larger of the two communities where most of our students come from. So Acton will continue to be our primary driver, and Boxborough is kind of a secondary piece. Now, if we were talking about Blanchard, where most of the students go, Boxborough would be the logical point.
Thank you.
Sure.
Other questions or comments from members of the board? Or Mr. Light, do you have anything that you would like to speak to?
No, my biggest thing is I just want to thank you all for the support. I appreciate the opportunity to come. If there are any other questions, I'm happy to answer them. But, I think what we've learned is, I know our community wanted a lot of really clear criteria, almost like a rubric for you're going to stay open if this is the case and you're going to close if this is the case. But I think what we've learned is it's so nuanced. And I know, Heather, Cheryl, and I meet with our leadership team in the district, as well as the Boxborough health agents every Thursday. We have about anywhere between a half hour and an hour long conference call. Just talk about what we're seeing in schools, general trends in the community, look at the public health numbers, evaluate the cases, see what we need to improve. And that's been a really helpful process to helping us think about when we need to stay open, if we need to close, going forward. So.
Okay, well, thank you.
Sure.
If there are no other questions or comments from members of the board, Cheryl, are there any questions or comments from members of the public? Okay, well, very good. Well, Mr. Light, thank you again for coming. I mean, I would encourage you to please, get on our agenda at any time you feel there's an issue, there's an emerging either opportunity or threat. And again, if there's anything that we can do from a policy perspective in terms of, rules in the town, we'll certainly be very interested in trying to approach those. So thank
Great.
you again.
All right. Thank you, everyone. Have a good night.
You too. Take care. So I believe that brings us to our first agenda item that we're almost an hour behind on, unfortunately, but it's on the potential Article 9 amendments. Is that what's next up, Cheryl?
It's correct. And I'm going to try. All right, so I think you can see them on my screen. So we've had, oh, by the way, this was advertised in the Beacon for 2 consecutive weeks. And then I Googled and then I looked at companies that have worked with us in the past years. And I sent a copy of this to all of them. And I did get feedback from one. I thought one was going to join us tonight, but I don't see him on the list. So we did discuss this once already. You guys, all the revisions are in red. The name was changed, and I think I got that right. But we can go back and talk about it. And then the other changes are here. So just to give you the feedback, so I had one company tell me that we had put on, I think it was D, yeah, if we don't use it for 2 years, it shall be abandoned, permanently secured by filling the wellhead with concrete slurry and by taking all other actions. So this one company said that if a well wasn't going to be used and they're closed loop geo wells, the well will already be grouted from top to bottom. So filling the loop with grout and or capping with concrete may be advisable. That was the one comment I have from one company.
Sounds reasonable, actually. Sounds like perhaps we should be less specific about securing the exact method for securing the well and just say, something like shall be secured by, as we say, or other acceptable method, something along those lines. What do members of the board think of that? Mr. Conaby?
Yeah, I think we can do secured by other appropriate methods as approved by the health department.
Yeah, fine.
I think that makes sense. And, I think, we can leave it 2 years, or we can, it could be a little bit longer. I mean, I don't think it necessarily has to be that short a time period, but that seems like a reasonable.
We could say 2 years unless otherwise, extended by the health department, or right.
Or yeah, that sounds fine. I think the only other comment I would make would be going back to the title. We still don't talk about wells. We talk about minimum standards, sanitization standards. I think we probably ought to say minimum standards for well and sanitization standards for public and for private and semi-private water supply. Yeah. And
sanitization standards, is that what you said? Oops.
You have minimum stands for wells, and I think you just get rid of the standards sanitization. I think just put for wells and private and public water supply.
Did I get that right or no? I thought that's the way I had it before, but
I was going to say, I think that's what it says.
Yeah. So I don't think in your copy that I had sent you, I don't think I gave you this one that I had changed the name. So that could be.
I'm just looking at the one on the website. That's fine.
Sorry.
I just want somebody, if they're reading the top of the article, to know, oh, wells, we need to look at this. Rather, that was.
Yeah, and I made sure when I advertised it in the paper that I wrote right in it the name change, so people would understand what what we were talking about tonight.
Good. So you've advertised it and you've had some changes. I would presume we're going to plan for another meeting or hearing, or just are you planning on closing the hearing tonight with comments?
No, I was, I think once we advertise for the public hearing, it's up to you, but I was intending on a closure.
Yeah, I would think that would, unless, it's obviously at the board's pleasure, but it seems to me that the changes we're making are don't change the intent or the effect of the regulation, and we're within the advertised and public notice of the hearing. But could I ask for the changes that we have suggested? Are there other comments from members of the board? People comfortable with these?
Hi, Bill. It's Mike.
Hi, Mike.
I wanted to suggest, and certainly people comment on this, but with these closed loop systems, I think it probably would be a good idea to specify food grade, and I'm not sure if that's the right terminology, but food grade glycol in this.
I think somewhere in my memory, and I can't point to it, that there's something that says that they have to be non-toxic.
Right. I think we've said that it should be a non-toxic heat transfer media. That was the requirement that we've been using with other recent permits, Mike.
Yeah, is that in a, sorry, I'm not, I don't know every word of this. Is that in a different section than what's in red?
No, it's in red where it says the heat transfer media shall be submitted to the health department for approval. So it should be covered there.
Okay.
4.2 A, where it says
Yeah.
well. Yeah.
Yeah, I mean, would there ever be a case where we would okay non-food grade, like forget if it's ethylene glycol or propylene glycol, but would there ever be a case that we would allow that?
I don't think so. I mean, I think this is meant to address, so ethylene glycol is antifreeze in your car. Propylene glycol is thickener in your ice cream.
Okay, so it's the ethylene. Like,
well, it could also be used as an antifreeze, Bill. They use it sometimes for non-toxic things for like RVs and certain residential
oh yeah, no, I understand. Yeah, they have water systems in RVs. They use yeah. No, I was just saying. In other words, when you can eat propylene glycol, so it's non-toxic.
yeah, I guess my point is in A, Mark, there's nothing about non-toxic.
Yeah, okay, you're right. I mean, it just says the media should be approved by the department.
Yeah, I swear it used to say non-toxic, but so perhaps submitted to the health department or health division for review of toxicity.
But you could certainly put right before heat, put non-toxic heat transfer media.
Sure. And I think that was done, Mike, just to address the idea it doesn't have to be a glycol. I mean, I guess
could be water.
Yeah, it could be ethanol.
That's true. Yeah, good point. Could be ethanol. You're right.
I guess that could be considered toxic.
Although
in enough quantities.
I'm not sure that there would be other. You'd probably need a hazardous permit for the ethanol. It is a explosion hazard.
You'd have to keep the
cost.
Yeah. I don't. Well,
everything could be toxic at certain concentrations. That's why I was thinking that putting non-toxic. I see what you're saying, but I was thinking that all of them are going to have a warning not to drink it or to inhale it, ingest it, or otherwise contact it without certain precautions. So I think we were covered before. I see your point, but I guess I'm concerned that would only mean water.
Okay. Ms. Becerra, I think you may have had a comment.
No, I was just going to say that the changes were fine. But now that we have this discussion, maybe just a little further definition of the, to address the toxicity of the materials that are put in the wells would be helpful. But I think the non-toxic heat transfer media is sufficient for me.
Okay, thank you. Well, Mark, you're probably the most familiar of our members with the precise legal requirements for hearings and regulations, but I believe we would be within our standings or appropriate action if we were to close the hearing and then vote on whether or not to accept the amendments. Do you see any reason why we couldn't do that?
Probably not. It doesn't seem like there's a substantial change, and it's not like we're discussing things that were not posted within the scope. So we certainly could close it. We've also in some cases closed it and then voted at the next meeting, considering how quickly we're having meetings. That may be appropriate since we really don't seem to have as many folks being able to participate at these remote meetings. So do we have any applications pending this week, Cheryl?
No.
So, I mean, I guess to be extra cautious and prudent, we may want to just close the hearing, get the final draft out, and then vote at the next meeting, but we certainly could vote it at this meeting. It's that's your discretion, Bill.
Okay. Well, my inclination, but it's just there's no basis for arguing one way or the other, would be to just, I think this is a relatively benign activity, and that making it over 2 meetings is perhaps unnecessary. But if that's the board's wish, I don't see a reason to why that would be a problem. But the first step sounds like it would be to close the hearing. So if there's a member so inclined, perhaps a motion to close the hearing would be.
Before we do so, Bill, can I just go down to the wording on D, which is highlighted on the screen?
Sure.
It shall be abandoned and permanently secured by or other. I think we just need to put a space by and get rid of secured by an acceptable method or by acceptable methods. Yeah, just delete it. And a space before it. Just clean it up. Yeah. I think that reads better.
Okay.
Okay.
Thank you.
I'd be happy to make it. Well, if there's, I guess before we make that motion, I don't know if there's any comments from the public.
There is not.
Okay. Well,
We've lost most of our public.
Then I'd be happy to make a motion to close the public hearing.
Very good. Is there a second?
I'll second it.
Thank you, Dr. Bell. All those in favor of closing the public hearing, please say aye.
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 I also vote aye. I believe, are there any opposed? Motion carries unanimously. So, as I previously said, my inclination would be to go ahead and accept these amendments, but Mark also has a point that we can circulate a final draft and vote on it at the next meeting. What's members' pleasure? Anyone have an opinion one way or the other?
Bill, it's Mike. I tend to agree with you.
Well, would you wish to make that as a motion then?
So moved.
Very good. Ms. Becerra, was that a second?
I'll second it, yes.
All right, very well. In that case, is there any further discussion? We have a motion made and seconded to approve these revised regulations. Are there any further comment from members of the board? Any comments from members of the public?
No.
In that case, all those in favor, please say aye.
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 I only heard Mr. Conaby. Mr. Cruz and Dr. Taylor, I did not hear you.
Oh, aye.
Yeah, I said aye.
Thank you. I'm sorry I missed it. I also vote aye. Motion carries unanimously. Thank you. So that now I believe moves us to a variance for 7 South Street. It looks like we have two problematic variances in a row tonight. By problematic, I mean very difficult sites.
Correct. So 7 South Street is the first one, and I do have the engineer in the audience, so when you're ready, I can let him talk. But so they are looking for a setback to a drinking water well. The regulation says in zone 2 that you need a 150-foot setback, and they're proposing 104 feet. The site is very tight, and it's problematic with there's just no other location for it. So one thing that I did find though was I found a letter in the Board of Health file from 1991, and I don't really understand what the letter means. And I was hoping maybe Bill or Mark, you remember, but the letter reads, the Acton Board of Health at its regular scheduled meeting of July 22nd, 1991, unanimously voted to determine that the existing wells on North, Cross, and South Streets have been abandoned for purposes of drinking water use and not abandoned for any irrigation purposes or accessory uses. The board also determined that these wells are grandfathered in regards to their use for irrigation or accessory uses only. All of the requirements of the board's regulation 9 must be met by these wells. So I couldn't find any information in the file as to why that went down. So I was hoping there was some memory there. The homeowner, I've spoken with the engineer, and the engineer has spoken with the homeowner, and they would prefer to retain the well for the drinking water and grant this variance with a requirement for testing. Given that it's 104 feet away, I don't know. I'm okay with, I guess, either way of either having them do rigid testing or hooking up to town water and decommissioning this well. So those are the two options that you would have before you, unless you want to grant the variance.
Okay, Charles, I apologize. Just a couple of clarifications. The owner of 7 South Street, the one that are proposing to upgrade their sewage disposal system, is also the user and owner of the drinking water well. Is that correct?
Correct.
Okay, so it's not a neighboring drinking water well, and they're currently using it for drinking water?
Correct.
And is town water available to the property?
It is.
And do they have town water at the property? In other words, is it they hooked up to town water?
They're not hooked up. I confirmed that with the water district today.
Okay. All right. Well, thank you. That's clarification. Perhaps maybe this would be a good opportunity to hear from the engineer as to why this would make sense versus the variance would make sense versus hooking up to town water.
So the engineer's Ted Doucette, and I will allow him to talk right now. Should be all set to go, Ted.
Okay.
Good evening.
Thank you very much. Yeah, it's I think it was all summarized pretty well by Cheryl, and I think I talked to the owner, and they like their well. He says the water is better than the town water. I will be 100% open and honest with you, and I want to make the correction that I was told that town water does run into the house, and that it's just a matter of turning it on. I don't know how that came about, but that's what I've been told. So, but I did confirm. I confirmed they're not. So when I called the water department, they also said well water. That's on well water. But I talked to him today, and he said he was connected. He just likes his well water.
Okay, so I'm just into Cheryl's earlier question about from 1991. I certainly don't remember the details, but what she read makes it seem like, there was probably some other similar issue, and that the answer was, well, you need to hook up to town water, and the owner of the property said, no, we want to keep the well, and we said, all right, that makes sense as long as it's only for irrigation purposes, since you have a functioning well. You can do that. So it makes me think that there was perhaps agreement at that time that they would be using town water for domestic purposes, and that the well would only be used for irrigation. So to continue to use it as a drinking water well seems to go against sort of what that earlier decision may have been in regard to.
Yeah, I can't make any assumptions. I wasn't there. I can't, I don't want to go on assumptions of what was agreed to and not agreed to at the time. This is where we're at. This is what he prefers. We're also absent any reason. I think there was a couple of test results that were attached to that letter. I think they were after them. I think they were 1995. So, absent anything else, we meet Title V. I understand you have high regulations. Obviously, that's totally in your purview, and this call's up to yours. I'm just here to let you know what the client wants to do. He's willing to test the water to make sure it's safe, and that's where he's at. That's a request.
Okay, very good. Questions or comments from members of the board for either the department or the engineer? Mr. Conaby.
Yeah. Long time ago, 1991. What's interesting is that it's not just for this property from the letter you read, it was for a whole bunch of other properties. Was that maybe when they extended the water district to that area?
Could be. I'm not sure though, but I could find that out.
Yeah, I have to confess, I do not remember the specific one from almost 30 years ago. But when was this system that is existing, sewage disposal system, put in? Was it at that time period, or was it pre-existing at that point?
The septic system?
I think it was before then.
Yeah.
He's been there a long time.
It's the 60s, I think, and I looked at it earlier.
Okay.
I'm sorry, that's one other question. Why are they looking to do an upgrade? Is the system in failure?
Oh yeah, it's in failure.
Yeah. No dispute, huh? Okay.
Oh no, I sometimes I usually don't speak in definitives, but on this occasion I will.
Okay. Well, makes it easier to make the decision. Getting back to the well, do we know? I mean, typically for water supply wells for drinking, they have to be tested and they need to be a bedrock well. Do we have any information on the depth of the well and whether it has been tested and the results?
I have information in the file that the well is a 200-foot well, and it has not been tested in, I think, I don't have the date in front of me, but I do think it was around 95.
So I'll just throw this out because this is one of those nettlesome problems where it's hard to come up with a good answer. In the past, the board has sometimes allowed a situation where if the owner can produce current test results should show the water is safe, the board has said, well, we'll allow it for the current owner, but that on transfer of the property, especially since they already have town water apparently on the property, that the conversion will be made to town water. Just as an option, I believe there's precedent for the board allowing something similar to that, if that would be of interest to members. Any other questions or comments from members of the board?
What about ongoing testing? A single negative test is not reassuring.
For drinking water, it's not bad. But...
Well, actually, Bill, I believe our local requirements are that it be tested on a periodic basis every 2 years.
Coliform every 1 year, chemicals every 3 years.
3 years, okay.
Okay.
So the answer is it hasn't been tested, which is not atypical, but certainly having any allowance or variance to allow them to continue to use it for the existing property owner would be contingent upon maintaining that sampling and monitoring with successful results. I guess when we get back to their issue, it sounds like it's close to the wetlands. They're proposing to put in a Presby system. Is that correct?
Yes, Presby and viral septic.
Okay. So that would require a variance as well, a local one?
I don't think so.
I can't.
We haven't been bringing the Presbys before you.
Okay. So the only variance that they're requesting would be for the continued use of this private well. And then as Bill suggested, if it be allowed, it could be for the current owner only, subject to confirmation and testing results that is potable and able to be used for those for that use during this time period. Is that correct, Bill?
Yes, that's, I think, what I was saying is an option should the board wish to move forward with it.
I think it is something we've done before.
Mm-hmm. Well, let me just ask for general feedback then. I'll randomly pick on Mike. Mike, what do you think? Would that be something you would consider, or do you think that's not a good idea? What's your initial thought? Oh, and we see the top of your head.
Yes. Hi. Yeah. Yeah.
Oh, you were relaxing during the meeting?
I was, yeah, stretching out. Yeah, my initial thought is if town water is available, it really should be hooked up.
Okay. Ms. Becerra, what is your top of mind? Yeah, I know it's a nettlesome one, isn't it?
It is, because I see both sides. I on principles, I agree with what Mike said, and but on the other hand, if the property owner has a well and likes the well, and the condition that you suggested that upon a property transfer it get converted, that seems like a reasonable accommodation. I don't feel strongly either way, but I think that I'd be okay with what you're suggesting.
Okay.
Yeah.
Okay. Thank you, Dr. Bill. What's your initial thought?
Well, if the test is negative when the system is failing, you probably can drink that well water. So I think the accommodation's fair if he's strongly insistent on that.
Okay. Yeah, as long as it's protective of the public health, that's, and in some cases, one of the reasons why we have the insistence on town water is that we believe it's continuously monitored and should be safe to drink. So whoever would buy the property, would be guaranteed that they're not buying a health hazard if it's on Acton water. However, if the current resident, is able to show that the water is drinkable and they have a preference for it, then they're not putting anyone at risk besides themselves. That to me seems like a reasonable accommodation. But that would also have to, well, I guess it doesn't matter if the Acton Water District is currently piped into the property. It would be a condition of the variance that they convert to Acton Water on any transfer of the ownership of the property. And I would assume that would mean with, and Mark, you could help on this, but, even if, like, say it was passed to a child, that would be considered a transfer as well, right?
It could be, but I think the intention, sale or transfer of the property is the typical terms we've used. But if they transfer it to an estate, that
or a trust or something like that.
Yeah, a trust or a life estate or something like that. I don't think we want to get down to that level. I think it's if the existing homeowner has been using it for decades and they're comfortable and like the water, and that seems fairly reasonable. But I think especially where the record indicates that it was supposed to have been connected and there has been a history of not testing the well, I think that probably that would be a prudent step to just allow the variance, but it'd be subject to connection to the public water supply upon sale or transfer. whereas otherwise directed by the health department. So if it becomes a hazard, if they don't provide test results or some things like that, then it would occur. So we would be assured that an appropriate water supply to make the property habitable is available.
Or say if their test results of the well indicate contamination.
Correct. I mean, we don't know that might not be, PFAS or, certain metals or organics or other things, arsenic. I mean, we don't have any test results, so we really can't determine what the water quality is. So, yeah, I think that those would be the conditions. It does seem that if they're making that knowing decision, then it's been existing for many years. Allowing it to continue a little bit longer for the resident does not seem to be unreasonable.
Okay. Did I just hear a motion?
Yeah, I would be happy to make that motion with the conditions as was amended. If Cheryl can have those.
I did. I was writing them. I felt like that was a motion.
I thought I was going to twist my arm for it, but that's fine. Thanks.
Is there a second?
Yeah, I'll second it.
Very good. Thank you, Dr. Taylor. Further discussion by members of the board? Mr. Cruz.
Bill, what were the additional conditions? Yeah, sorry, Bill.
No problem.
What were the additional conditions?
Do you want me to read it?
Yes, please.
Convert, so the give the variance to the well to be set back to 104 feet, and it has to convert to Acton water upon sale or transfer of property, or ownership, or otherwise directed by the health department, or if the well is contaminated.
And I guess I would
probably say if it doesn't meet drinking water standards.
Yeah, and I had just one other slight nuance since we're just, thank you for reading it back, that it would be converted, the property would be converted to the public water supply and the well cease to be used for drinking water.
I think connected rather than converted is the typical way it's described, Bill.
Okay, sounds good to me. Okay, other comments from members of the board on the motion that has been made, and I assume Mr. Conaby and Mr. Taylor, Dr. Taylor, you're acceptable with the amended wording?
Yes.
Yes.
Thank you. All right, well, hearing no other comments, in that case, let's please vote. All those in favor of the variance with the conditions as amended, please say aye.
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 Mr. Cruz?
Nay.
Very good. I will vote aye. So motion carries 4-1.
Okay, thank you very much for your time. Cheryl, if I can just I'll have to get in touch with you to get the parameters and then just obviously a copy of the approval, just so I can get it to them. So I'll be in touch sometime this week. Thank you very much.
All right, thanks.
Thank you. So I hate to say this, but I think this was the easy one.
Yeah, this one, oops, that's not the one I wanted to share. This one is a mess. It is in zone 3. They are looking for multiple variances. Hold on, let me see if I get out. They are looking for a variance to the cellar wall from 20 feet to 15 feet. They're looking for a reduction in the separation of groundwater to 5 feet. And they're looking for a reduction of the setback to the recharge, retention, detention, or surface drainage area from 100 feet to 50 feet, and the floodplain from 100 feet to 0 feet. So this entire property is in the floodplain. It is a failed system. The health department would recommend approval of these variances with the addition of nitrogen reduction. I do have a the contractor that's on as a participant. If you after we finish, if you want to ask him to talk, he does not want to put in nitrogen reduction. So that's kind of where we're at.
Okay. Could I just ask, Cheryl, I think I read the note from Evan, but basically this is determined to be maximum feasible compliance. Is that effectively the words?
Absolutely correct. There's no other options here.
Okay, thank you. Questions from members of the board? Okay. Mr. Conaby.
Yeah, like always, a few questions. The system is in failure. Is the building occupied, and how old is the system?
I did not look to see what, I think it's existing, Mark, and I'm not sure. I don't think the building's occupied. I think this house is being renovated.
Okay, because I was reading the letter request and it sounded like they bought it as is, whereas. Can you give us a little background on that?
So I don't know a lot about that, but the contractor can talk about it. But it seems like he did buy it as an as is, and I'm not sure. I chatted with Devin about this earlier, and he didn't know enough about it. So it's probably best that I have the contractor answer those questions. But you know, Evan thought maybe it might have been an affordable house. That I don't know. So I think we should have the contractor talk about that.
Well, I just wanted to know whether there was any town action or representations or anything else that would impact this decision. That's what I'm trying to find out about.
I'm not 100% sure, Mark. You know, Evan wasn't 100% sure either. So I don't know. Not that I'm aware of, but maybe the contractor knows differently.
Okay. And as far as what Evan wrote, I believe he recommends the nitrogen system be provided as maximum feasible compliance. It'd be nice if that was written in there. And I obviously, it talks about all comments must be addressed. I think we should probably just be saying that she'll meet all other applicable, requirements and she'll be subject to department approval. So we're clear that we're only granting, if it would be on the these variances with the conditions of the nitrogen removal, and everything else would be required.
So, Gerald, to your point, I think that there might be some, we should hear from the contractor as to why nitrogen removal doesn't make sense, because initially it seems that that's the department's recommendation. And
yeah, I think it's just solely financial, but he can speak to that.
So if he would wish to, if he'd like to address the board, that would be fine.
Yeah. Oops, sorry. Sean, I'm going to allow you to talk. You should be able to talk now. Just need to unmute yourself.
Good evening. Can you hear me now?
Yes, we can.
Yes.
Good evening, board. Thank you. Thank you for having me. So to address 101 Stowe Street, I think you hit, I agree, you hit the nail on the head with the property. It's a mess.
Okay, well.
And and for many reasons, and this is as you already said, this is the maximum feasible compliance setup that we could come up with. And although we meet all of state requirements, there's no way that we could satisfy all the local regulations. So the one set forth, the four that were already listed out. And I do recognize that in the past, the board has recommended nitrogen reduction technology in situations with Title V issues in Acton. With this property, it's an atypical situation. And when we purchased this property, we had intentions on renovating it revitalizing it and bringing it back to life, because the septic system was failed for some time. I'm not sure how long, but it was failed. The homeowner at that time did not have the ability to upkeep the house or fix or repair the failed septic system. The property was also an affordable housing property. So our purchasing of the house and the sale of the house had to go through the town and the state for approval, specifically with the price and the acceptable price, because of based on equations, the homeowner, Michelle, was entitled to a certain percentage of the sale price, and the rest was allocated to the town, state, whatever departments it goes to. So while we're negotiating, we went back and forth, and I ended up getting a Title V inspection done. And while we're talking and discussing a potential deal and a sale, we came to terms with a price for a replacement cost of a septic system, as they recognized the system was failed. It did need to be replaced. It was in the town's best interest to replace it and get the sale done so we could renovate it. So with that being said, we worked that into our numbers, came to a price, and we closed on the house. And we did not go with other plans of increasing square footage or increasing bedrooms or anything like that, because of the property's location. It was built in a flood zone. There, the request of going to a zero from 100 in the floodplain is because that's there is no other option, because the way it was built and where it was built. So with our numbers and with our engineer that put these plans together, this is the best that we could do to meet all the requirements of the state as well as Acton. And
I think we lost you there.
As you said, incur undue cost with the nitrogen reduction technology for us, as well as future homeowners on the yearly maintenance cost of it.
Okay, well, thank you. So I'll just, boy, this is a complicated issue. My personal concern, and there's obviously other members of the board I'm sure will wish to weigh in, but with the proximity to the wetlands, as well as the fact that every so many years the entire system will be submerged, makes me think that nitrogen reduction is a good idea, particularly, like I say, the proximity to the wetlands. That's a very typical requirement that this board has imposed. As far as the difference between what's a local requirement and what's a state requirement, I would have to assume that at some point there's probably a state requirement contingent in there as well, but I'll leave that to Cheryl. My opinion is, we certainly want to be flexible and provide you an opportunity to make use of your property, but I would think nitrogen reduction technology in this particular case makes sense. But let me just ask other members of the board, what are people's opinions? Anyone? Mr. Conaby?
Yeah. I mean, typically this has been a standard requirement for, like you say, with being the proximity to the wetlands. The floodplain just exacerbates it. And this is probably going to be a condition that the CONSCOM is also going to be looking for. So it seems like it's a pretty standard requirement for a pretty bad situation, unfortunately. But hopefully if this is maximum feasible compliance, that seems to be the best that we can offer.
Okay, thank you, Mark. Any other members? Ms. Bissetta, I see you're unmuted, but I'm not sure if that's because you'd like to say anything or you just happen to be unmuted.
I had forgotten to mute myself, so I'm glad I've been quiet. But, you know, I agree. I think that given, you know, the fact that it's in a floodplain, close to the wetlands, in an aquifer protection zone, it's just a bad site. So anything we can do to enhance compliance, such as nitrogen reduction, I would be in favor of.
Okay, thank you. Others, Dr. Taylor, Mr. Cruz, Dr. Singh, Dr. Jacoby, comments?
I agree with the comments made.
Thank you, Dr. Taylor.
I also agree with the comments made.
Thank you, Dr. Singh.
I just have a general question. Are houses allowed to be built in the floodplain?
I will say Mark again is probably the expert in that, but generally no. However, you know, it depends when the floodplain was.
Yeah, the short answer, it depends. And, you know, you can have certain building within the floodplains, but there are certain requirements to do so. But in general, this is an old house that was built prior to all those regulations and the mapping, and the floodplains do change with time. So I don't think you'd see that house there now is the short answer.
Now, a more interesting question, not that this board needs to address it, but if the house was to be somehow damaged, could it be rebuilt or destroyed? Could it be rebuilt in the floodplain? I don't know. I guess that depends what's the classification of the floodplain and a lot of other matters. Anyway, getting back to the matter at hand. It sounds like, Cheryl, and just help me here, is the variance that you're proposing is written by Evan, includes nitrogen reduction, is that correct?
He put that in as conditions, yes.
And the plan that's been submitted includes it or does not include it?
The plan submitted does not include it.
So we don't have a plan that would meet the conditions of the variance currently, is that what I hear?
Correct. He would need to redo the plan and add this and then resubmit it for approval.
Okay. And that would be a department review? There'd be no need for the board to review it?
No, there would be no need to bring it back before the board, as long as the board, let's see. So I'm just looking, I think the policy that you've given me, that you've allotted me allows me to grant the variance for number 1 with nitrogen reduction technology. For the number 2, they can get depending on what technology uses, he could get maybe a 2-foot reduction. So potentially he could go from 6 to 4. And then the other one, the setback to the retention, I think I would need you to grant that variance as well as the number 3 and number 4.
Okay. Well, again, it's sort of up to what the members would like to do, but it seems like there's a general consensus that the board might be willing to grant the variance, but as written or as proposed by Mr. Carloni, Evan Carloni, with those conditions. And I didn't hear anyone suggest a modification to those conditions.
We did want to modify them. I think that it should be that is only a variance for these specific conditions, and it would be subject to approval by the health department of the plan. So because we don't have a plan in front of us, so we would normally require it to be a compliant plan with these variances, if granted, be provided for approval by the department.
Okay. I know I've been giving you the yeoman's work tonight, Mr. Conaby, but is this also something you would feel comfortable making a motion for?
Yeah, I think I would also just make sure that we reiterate that it is a failed system and this is maximum feasible compliance. And then with the conditions as amended, recommend that we approve the specific variance requests from as listed.
Okay, very good. That's a motion. And I'll ask, is there a second?
I'll second it.
Thank you, Ms. Becerra. We have a motion made and seconded. Any further discussion from members of the board? Are there any comments from members of the public?
No.
Okay. Mr. McHugh, I just want to, I know that the general discussion may not have been in the direction you were looking for, but is there anything that you'd like to add prior to us voting?
No, that's everything.
All right, thank you. In that case, members, all those in favor, please say aye.
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 I believe that was everyone. I also vote aye. Any opposed? Hearing none, I declare the motion passes unanimously. Thank you, everyone. Boy, we haven't had these in a while. Mostly we've been concentrating, I know, on the pandemic, but these are particularly difficult variances. And now it looks like we turn our attention to beavers once again.
Yes. So this property was before you previously. It's been quite a few years, but they are, the beavers have returned to this area. They're flooding a culvert, and they're proposing, we're recommending that you grant a emergency permit because of the encroachment to both the septic system and the barn that exists at the property at 40 Brook Street. And we're recommending that you begin that starting tomorrow for a 10-day period.
Very good, thank you. So I do remember, I think, this property, and there was one other feature that was the basis for the beaver trapping permit, which was a National Geographic Survey water gauge, I think, was located that was in danger of being submerged.
Yeah, that was actually applied for by the U.S.
GS or something.
Yes.
Wasn't that further up? I think
It
that
was further up. I was going to say this property was specifically impacted last time, not related to that one you're talking about. I mean, they are related because they're on the same brook, but.
Yeah.
Okay.
It was upstream of it, but yeah. But the pictures were fantastic evidence of the beaver activity.
Yes.
Bill,
Mr.
I will
Cruz.
make a motion to approve the permit.
Thank you, Mr. Cruz. Is there a second? So I'm going to pick on Dr. Taylor. All right. Thank you, Joanne. I was going to say, Dr. Bill hadn't seconded. Well, actually, no, that's not true. He did second a motion tonight. Anyway, we have a motion made and seconded to grant the beaver trapping permit. Further discussion by members of the board? Comments from members of the public?
There isn't.
Very good. All those members, please vote. All those in favor, please say aye.
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 Dr. Bill, I don't think I heard you.
It was blended, but with someone else. Aye.
Very good. Thank you. I also vote aye. Motion carries unanimously. Thank you. That means we get to turn our attention to the minutes of November 2nd, which I've read. I don't know if anyone else has had an opportunity to read them, but I had no comments. Any other members have comments on the minutes of November 2nd?
Nope, I thought they looked good too.
That could almost be interpreted as a motion.
I move that we accept the minutes as written.
Second.
Oh man, it must be getting late. We're getting
punchy.
Yeah. But I distinctly heard a motion made and seconded to accept the minutes of November 2nd as written. So in that case, members, please vote. All those in favor say aye.
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 Very good. I also vote aye. That motion carries unanimously. Well, thank you. That brings us to the end of tonight's published agenda. Cheryl, is there anything else that we need to cover tonight?
Yeah, so before you vote to adjourn, which I'm looking forward to because it's been a long week, our next meeting is scheduled. It's a long week and it's only Monday, so not good. So our next meeting's technically not scheduled till the 14th. So do you want me to book one next Monday, the following Monday, and the following Monday after that, and just put them on the books and pick one? So it would be November 23rd, November 30th, and December 7th.
So my suggestion would be that we should certainly do the Monday after Thanksgiving.
The 30th?
Yes.
Okay.
Just because of impacts potentially from the Thanksgiving holiday. I would suggest the Monday before Thanksgiving we not schedule a meeting for. And then I guess it would be a week from tonight. Is the week before the Monday before Thanksgiving, is that right? Or
No, so next week would be the week of Thanksgiving. So next Monday. So then it would be 2 weeks from tonight, the 30th.
Okay, I would suggest that we schedule a meeting and we'll cancel if there's no need.
For the 23rd, for next Monday? Or do you mean for the 30th?
For the 30th.
Okay, so I'll schedule one for the 30th.
Okay, and I'm sorry, so next Monday is actually the Monday before Thanksgiving? My gosh, time flies.
Yeah. Next week is Thanksgiving.
Oh, yeah.
I know.
Okay. All right. And then, so December 7th-ish, approximately, would also be a Monday. Is that right?
Correct. And
you said our next meeting is this 14th?
The 14th of December, yes.
So is there any reason, maybe, is there a holiday or some other activity around December 7th? I'm not
Yeah, I don't know. I'll have to look. I mean, normally we only do one in December, and we usually do avoid the week of Thanksgiving. But I do think we have that whole extra week in November. So I agree. I think the 30th we should definitely schedule. And let me take a look at December 7th to make sure it's not a holiday.
Okay.
Anybody?
Cheryl, you asked for next Monday. Was there something you anticipate while you're asking for a meeting?
No, I jam-packed this meeting so we wouldn't have to meet again. That's why we did the revised agenda. So, not that I don't like seeing you all, but
virtually, of course. It's the only way you get to see us without a mask.
Yeah, exactly.
All right,
I just have a quick. Oh, go ahead.
No. I was going to say
scheduling.
Yeah, just please for the 30th, and if there's no interference, then also please schedule for December 7th, and we can cancel if there's no need. And so, please, Ms. Facetta, go ahead.
Yeah, I was just wondering about the seasonal flu, whether we've seen any activity or it's normal or what, overshadowed by COVID.
Yeah, unfortunately, COVID is prioritizing our time. I have not heard anything, Joanne, but I can find out.
Well, I guess no news is good news, so we'll go with that.
All right. Well, if there's no other business, I believe probably many people would be looking forward to adjourning. Anyone care to motion?
I'll make a motion to adjourn.
Thank you, Dr. Bill. Is there a second?
Second.
Second.
I was almost going to say traditionally that's Mike's role, but yeah.
It is.
All right,
wake him up.
But but I believe the credit goes to Joanne. So motion is made and seconded to adjourn. All those in favor, please say aye.
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 I believe it's unanimous. The meeting is adjourned. Thank you again, everyone. I can't explain it. Our meetings seem to be becoming more complex or putting more challenges in front of us. So thank you all for stepping up and hanging in there. And good night. And since I just found out that Thanksgiving is much closer than I thought it was, I hope everyone has a happy Thanksgiving, a happy and safe Thanksgiving.
Yeah.
Thank you.
Good night, everybody.
Good night.
Good night.
Night.